So ideally what we want to get out of this taping is we want to tape your knee in the position or the angle, the knee angle, from which it irritates when you're being active. Welcome back to the channel. So in today's video, I want to take you through the taping technique that I use for my patellar tendonitis or patellar tendinopathy patients. And then following on from that, in the second half of the video, I want to go through something that I'm finding clinically that I don't think many other people have either discovered or at the very least talking about in terms of a potential hidden cause of patellar tendonitis or patellar tendinopathy. So before we get into the video, if you go on to enjoy the video and find it genuinely helpful and useful, please consider leaving a like rating down below. Subscribe to the channel if you are new, if you find this type of content interesting. And if you do ultimately find that this video genuinely helps you feel a missing piece of the puzzle that you've been looking for, please consider leaving a super thanks donation on the video. It's just a great way to help support the channel and keep it going forwards. So getting into this taping technique, the first thing that we need to talk about is that you go and do a particular movement or a particular activity that generates your symptoms so that you have something to compare it to post-taping to see how effective that taping was and whether you need to modify that taping before going and doing what you need to do. It could be hopping, it could be running around, it could be jumping, it could be doing deep squats or lunges. Get a general sense of how that feels, then do this taping technique, and then afterwards we're going to compare the exact same movements to make sure that you have at the very least a 50%, if not 100% change in your symptoms. Now what we're going to get you to do is we're going to get you to measure out the amount of tape that you need, tear that tape down the middle. So we know that that patellar tendon attaches from the top of your shin and then inserts into the base of your patella or your kneecap. So we want to make sure that the strip of tape that you use is maybe half that distance so that we can really be specific on where we're targeting and where the pressure goes with this tape. So let's, for the purposes of this video, assume that your pain is at the base of that kneecap where the tendon attaches into it. What I want you to do with this tape is you generally want to place the tape directly over that spot. Now what I like to do here is I like to place a little bit of the tape coming upwards because we want to try and put a little bit of pressure and a little bit of force up into that kneecap to try and help distribute and capture those forces a little bit better. I like to pinch underneath the tape, just to pinch the skin a little bit, so that when I tape over the top of it, there's a little bit of a skin pinch going on there. And I find clinically that just helps get a better purchase on the skin and make the taping technique itself more effective and more efficient. The other thing which is really, really important and almost vital for any taping technique is the angle that you have your knee in when you tape. It does matter. So ideally what we want to get out of this taping is we want to tape your knee in the position or the angle, the knee angle, from which it irritates when you're being active. So if you're someone who just gets patellar tendonitis or patellar tendinopathy symptoms when you're running, take note of what particular knee angle you get that pain, and then when you place the tape on at that angle to give yourself the best chance of protecting your knee and the symptoms when needed. Because again, we want to provide you the most supports when your body needs it most. So it's a really nice way to figure out where exactly that you need it to be. But we're not going to know specifically for you where you need to be or how much pressure you need to put through the tape or how hard you need to pull the tape unless you have a before and after measurement so that you can clearly see what's working for you and what isn't. Now obviously putting tape straight onto hairy legs isn't advisable. So if you feel like you're constantly readjusting the tape, make sure that you put one strip down first just so that the hair's not consistently getting pulled out every time you have to take it off and readjust. If you have another strip of tape, you can tear it and then just keep taping over the top, trying to find the right angles that work really well for you. So that particular taping technique with good before and after testing is a really powerful way to support the symptoms associated with patellar tendonitis or patellar tendinopathy. Now, obviously, there's a lot of things that go into improving patellar tendonitis in terms of, eccentric loading and glute strength and core strength and flexibility and all these sorts of things. But what I'm finding clinically with my patients is that the majority, if not all of my patellar tendonitis patients have some very specific segmental dysfunction in their lower back. And what I'm finding is that by releasing the restrictions and the stiffnesses and the tightnesses and the issues associated with that segmental dysfunction, I can see an immediate increase or an immediate improvement in a lot of the symptoms associated with patellar tendonitis. Now, what's really important to clarify here is that if you have a patellar tendinopathy or a patellar tendonitis, we know that the tendon itself has to change and morph a little bit to get to that point where it is now dysfunctional. So I don't want it to be mistaken that by treating your back that all of this is going to completely fix itself in an instant. But what I'm finding clinically is by improving the function of the lower back in specific areas that might be changing the way that we're loading this knee, we are optimizing the function of the knee and giving it the best chance for things to settle quickly. We can start to see some important changes in the symptoms and the pain associated with patellar tendonitis while we're working on the other things to make that tendon normalize. We still want to make sure that we're doing a test beforehand and then reassessing things with a test afterwards to know specifically and exactly what effect this lower back may be having on your knee pain and symptoms. Then what we want to do basically is you want to go looking through the base of your rib cage and the top half of your lumbar spine. You want to find a spot that feels stiff, tight, and restricted. You want to get that tissue to release and feel less restricted, and then reassess how your knee symptoms feel. So we want to get you to place the foam roller originally at the base of that rib cage, and we can move up or down depending on what you find. Move the roller to a point where you feel like there is some stiffness or some tightness or some restriction. And I think the reason why this potentially is missed a lot by a lot of people is that not many people tend to have pain associated with their low back just walking around. All that pain is in the knee. So we live in this world at the moment where if something doesn't hurt, we automatically assume that everything's fine. Obviously it may be fine, which is why it doesn't hurt, but a lack of pain doesn't mean that everything's functioning normally. It just means it doesn't hurt. So you can have a joint in your back that's really stiff and it may be creating some dysfunctional movement patterns or creating a chain reaction of events that's being felt somewhere else. So we want to explore that for you. So again, once you've found a level or a segment of your spine that feels a bit stiff, as we always do, just rotate to one side a little bit, get a sense of how you feel the roller sinks in, rotate to the other side, and compare the two sides. So in around about 50% of cases, the stiffness at the connecting spinal segment will be on the same side. But the interesting thing is that leaves about 50% of people who actually have most of their stiffness on the opposite side. But your body functions as a whole. It doesn't function as a left or a right as much as we think it does. It just functions as a trunk. So if you're pulling something out of one side, that can affect everything around that side above and below, but it can also affect the same stuff on the opposite side as well because it's physically connected. So for me, there's a spot here that feels a little bit stiff. Now you can place a bunch of pillows here so you feel you can relax. I'm relatively flexible enough where I can bend all the way over, but essentially all I'm doing is I'm getting the roller to dig into that stiff section. I want to take a couple of deep breaths into here. I want to try and relax as much as I can so that tissue starts to give. Then once you've had enough, and you might have been there for 30 seconds, a minute, 2 minutes, whatever you feel comfortable with, then just gently roll the roller down a fraction lower, go looking for the next spot that feels stiff. And by doing that, by segmentally working down your spine from sort of the base of the rib cage down to the midsections of your lower back, what I'm finding clinically is you might find that a couple of those segments or a couple of joints within those segments are unusually stiff and tight. And then as I said before, once you spend some time doing that, recheck the same movements that you did beforehand, whether it was a squat, a hop, a jump, jogging around, whatever it is, then assess how that feels for you. And what I'm finding with my patients is that by removing some of that segmental stiffness, we start to see a subtle improvement in those symptoms even before the tendon itself begins to change. I really wanted to attach that to the taping side of things because I always want to promote that you need to make sure that you are feeling comfortable that you can get some symptomatic relief, whether it is taping, whether it's massage, but it's not enough to give you short-term stopgap solutions. We have to have a bigger conversation around why that exact part of your body is failing, why it's not perfect, especially if the other side is relatively good or better in comparison. So with that being said, I hope that was genuinely helpful. Please let me know in the comments down below, how you found the taping technique, and then let me know what that lower back component does to your symptoms and what effect it may or may not have on your issues going forwards. So as I said, I hope that was genuinely helpful. I'll see you in the next video. Take care. Bye.